America is aging fast. There are now almost 50 million seniors that are 65 and over in the United States. And the number is expected to double in just a few years. Because of their age and their health issues, many seniors are homebound or less mobile. And they need a bit of help when it comes to just getting normal, everyday routine tasks done, like meal preparation, housekeeping, shopping, errands. Candidly, I'm 56. Changing my linens is difficult. Can you imagine if you're 84 years old and doing that? Many seniors want to remain in their home. That's called aging in place, and believe it or not, 90% of them would like that. At home, they've got their familiar surroundings. They're surrounded by their thoughts and their memories. They've got their privacy, and most importantly, still have independence. Because of the senior population boom, the demand for in-home senior care has grown swiftly. And to keep up with the pace, more and more folks are looking for home care. It's a profitable and satisfying way to help others in your community, and candidly, it's a great source of earning a living. If you're not familiar with it, you may have some questions before you're ready to get started in being a senior care agency owner. Here are some of the most commonly asked questions that I thought you might be interested in hearing about. Number one, what does a senior care home provider do? Well, most senior home care clients are between the ages of 65 and 95 years old. They're living in their own homes, which is where they want to be. It's called aging in place. And they just need help with what in our industry we call activities of daily living. And these are toileting, bathing, ambulation, feeding. Then in addition, there are IADLs, medication reminders, linens, laundry, things like that. A home care provider helps them stay at home by taking care or assisting them with those tasks. And also, more importantly even than that, it provides companionship. It allows your client to have somebody to talk to. If they've got macular degeneration, somebody to read their mail to them or read a book to them. Or it can be as simple as even playing cards. Number two, how much are senior home care providers paid? Well, there's a big difference in the pay for caregivers who work for a home care agency and those who have their own independent home care services. For example, an agency might charge the client $28 an hour, but can only pay the caregiver $12 an hour. This is a business with built-in profitability, folks. It's simply a matter to see what the going rate is for private pay for clients in your area, and we help you do that. We do a survey, a market survey in your specific territory. Third question, who hires senior home care providers? Well, senior home care professionals are the best referral source for potential clients. The number one leading referral in our industry is case managers from hospitals. Increasing demand means that they're always looking for quality agencies to work with. At-home Eldercare franchisees offer that quality due in large part to our comprehensive training and support structure that we have in place. Number four, what accounts for the rapid growth of the businesses? Well, there are two reasons for this. The first is demand. Medical advances have made it possible for seniors to live longer lives. And we hope to have a higher quality of care, right? Second, the increasing cost of healthcare has created a growing demand for affordable in-home care. The third reason is the pandemic. Aging in place is the way that you want to go when it comes to caring for your aging family member. Number five, what's the difference between in-home health care and non-medical home care? Well, home health care requires Skilled care. A registered nurse is going to be delivering that care. They bill Medicare and they bill Medicaid. Home care, on the other hand, uses paraprofessionals like certified nursing assistants and caregivers, and we bill privately and we bill Medicaid. Those are the two primary differences between a home health agency and a home care agency. Another example of that might be medication administration. Home health can apply and give medications. Home care agencies cannot. Number 6 question that we get frequently is, can I work part-time? Yes, in some instances you can. But keep in mind that you're running a business, and if you get out of it what you put into it. If you put in part-time work, then you're going to get part-time results. If you're putting in 40 or 50 hours a week, you're going to get 40 or 50 hours worth of hours a week worth of effort out of it. A perennial question that we get constantly is it expensive to get started? An at-home elder care franchise costs less to purchase than the majority of home care franchises. The industry average is $50,000 for a franchise fee. Ours is $45,000. Another difference, the industry average of royalty fees is 6%. At-home elder care is 5.5%. Another thing contributing to the expense is running the business from your home. Can you do that? Absolutely. In fact, we encourage you to run it from your home for the first 6 months. After that, we expect you to be able to get office space. We want you to control your expenses early on when you're just starting out the agency. And rent is one of those things. Another question we get is, do I need to have a medical background in this, or what kind of a background do we need to do this? No. With our support, our training, our startup kit, we have taken individuals out of totally disparate industries and turned them into home care senior experts. And we can do the same for you. Most of our clients have come from industries as diverse as real estate, banking, IT, the furniture industry. They knew nothing about senior care or home care before they came to us. Now they're experts. A question you should be asking yourself, number 9, a question you should be asking yourself is, how do I find customers? Well, there are many avenues to pursue for obtaining employees and clients, to the point that we'll spend almost 4 full days with you in our initial training, exploring the various methods of finding clients and attracting great help. No special skills are required, but you do have to have a little grit, and you got to have a lot of determination. Number 10 on our list, do I need any special training or a certification? The answer is most states do require some form of certification or licensing. We happen to be licensing experts. We've trained for the North Carolina Division of Health Services Regulation for the past 13 years. I would venture to say that we are probably the only franchise out there that has got 13 years of licensing experience and expertise. As a home care provider, as the owner of the agency, you can earn a solid, dependable income regardless of what the job market is doing. It's as close to a recession-proof business as you are going to find. As seniors continue to get older, they want to remain in their homes. They are going to require some in-home care. For more information about at-home elder care, stay tuned for our contact information. It's at the end of this video. Thanks. Have a great day, and thank you for listening.